this vaccine is really the ray of hope that's going to lift our spirits and help us defeat this virus.
Well, that was a historic moment for our community. That is Dr. Ojogho being the first person vaccinated with the COVID-19 vaccine here in Spokane.
Yeah, this Saturday he will take part in a virtual discussion on the COVID-19 vaccine for our Black community. Now this morning he's joining us now live on Up with KREM. Dr. Ojogho, good morning. Thanks for being with us.
Good morning.
I want to jump right in.
Invitation.
Yeah, I want to jump right in. How does it feel to be leading the charge for vaccinations here in our community?
It's really it's essential. It's essential work, and I feel privileged to be part of that, and also to help educate our community with regards to the vaccine.
Yeah, and recently we know the Washington State Department of Health released new data showing low percentages of Black, Hispanic, and multiracial people having received the COVID-19 vaccine compared to their state population. Why do you think those numbers are so low?
Well, as we all know, the data shows that the COVID vaccine has had a devastating impact on the people of color. And part of that is that they're having to deal with the vaccine misinformation. And on top of that, there's existing distrust of the healthcare system. So all of those things combine almost like a triple whammy effect to influence the decisions around vaccination.
And I want to ask you, what are some of those concerns you're hearing from patients? You know, we don't want to spread more information, but what are some of the concerns you're hearing and how can you debunk them this morning?
Well, and you're right. I think we shouldn't be repeating some of those, but we are going to be addressing some of those questions head on this weekend on Saturday. But you may hear people speak to the effect that they're uncertain about the effectiveness of the vaccine. Well, we know that the FDA and other experts have examined this, and it's quite clear that it's one of the most effective vaccines we have in terms of the percentages of over 95% effective in reducing the risk of infection.
Now tell us more. You mentioned briefly you have a panel coming up on Saturday. Tell us more about those efforts to reach members of our Black community about getting the vaccine.
So what we've done is through the partnership with community leaders, as I mentioned in the beginning, we have the Black Lens, the Spokane NAACP, the Kalmaxi Center, the Spokane Ministers Fellowship, and even Providence Healthcare as well. So I think what we're trying to do is address these questions and address any concerns, including the misinformation, in hopes of improving their ability to make informed decisions around the vaccine. You may hear, as I said, about the effectiveness. We've talked about that. Everybody understands that FDA and the experts have concluded that indeed you have over 95% effectiveness. You may hear about potentially severe adverse effects. Well, of course, like all vaccines, there's potential risk, but when you compare the risk of the vaccine versus the risk of getting the infection, the vaccine clearly gives you an advantage and it gives you a benefit. There are some minor risks, including pain and fever, some muscle aches, and then there may be severe reactions. Fortunately, those are very rare, and that includes anaphylaxis, which is why after the vaccine, you're supposed to be observed for about 15 to 20 minutes just to make sure that no such reaction takes place. And if indeed it does, then there's immediate medical help.
Well, Dr. Ojogho, thank you so much for being with us this morning. Again, you can join him and a panel of medical experts this Saturday to talk more about the COVID-19 vaccine. For information on that, plus how you can secure an appointment in our area, just text the word vaccine to 509-448-2000.